Welcome to the Royal Berkshire Hospital Clinical Skills Training video. This video will demonstrate how to safely insert a peripheral venous cannula using a standard aseptic non-touch technique, commonly referred to as ANTT. Wash and dry your hands as per trust protocol. Wearing non-sterile gloves, clean your tray with a green Cannula wipe and leave to air dry. This will create a general aseptic field. Decontaminate your hands. Gather and prepare equipment using a non-touch technique, protecting key parts by using the sterile packages or microcritical aseptic fields. The required equipment includes a FREP applicator containing 1.5 ml chlorhexidine and alcohol solution, size appropriate cannula, cannula dressing, cannula extension set, sterile gauze, required blood bottles, patient identity label, and a sterile luer lock vacutainer. Check the pre-filled 0.9% sodium chloride syringe. Remove from the dust cover, loosen cap and expel air. Replace the cap to protect the key part from contamination. Decontaminate your hands and apply a disposable apron. Introduce yourself to the patient, confirm patient ID, name, date of birth and NHS number. Check allergy status, explain procedure and gain consent. At patient's bedside, decontaminate your hands and apply non-sterile gloves. Prime the extension set with 0.9% sodium chloride to prevent air embolism. Leave the syringe attached to the extension set to protect the key parts, then place onto the open sterile packet. Apply a disposable tourniquet and locate a suitable vein. Pinch the FREP to break the glass and release the liquid inside. Dab on the patient's skin to activate, then using a crosshatch motion, clean the skin for 30 seconds. Discard the FREP in the sharp spin and leave the skin to air dry. Prepare the cannula ready for insertion by flattening the wings. Anchor the vein below the puncture site and insert the cannula at an average angle of 15 to 20 degrees using a non-touch technique. Use sterile gauze for any blood spillage. Once the first flashback is visible, lower the cannula parallel to the patient's skin and insert slightly further. Slowly pull back on the back plate to obtain a second flashback. Once obtained, fully insert the cannula. Secure the cannula with 2 strips from the dressing. These should run parallel to the cannula and should never cross. Release the tourniquet. Using sterile gauze, apply pressure above the cannula insertion site to occlude the vein. Then remove the safety stylet and dispose of immediately into the sharp spin. If you require a blood sample, once the safety stylet is removed, attach a sterile luer lock vacutainer. Considering the analytical order of draw, attach the blood bottles to the vacutainer. Once the bottles are full, remove and rotate. Occlude the vein, remove the vacutainer and dispose into the sharp spin. Attach the pre-primed extension set and flush with the remaining 10 ml of 0.9% sodium chloride using a push-pause technique, as this creates turbulence in the line and prevents blockages. Ensure the patient does not experience any pain or swelling at insertion site. Clamp the extension set on a positive pressure. Cover the entire cannula with the dressing to protect the key site and reduce the risk of phlebitis. Document the date and time of insertion and attach to the cannula dressing. Remove and dispose of all waste. Wash your hands as per trust protocol